A visible limb that reveals excruciating pain. But Alan Jonathan's pain is not only physical, it's also mental. He's faced with massive problems on how he can pay for treatment on his hip. He must have an operation, but without healthcare insurance coverage, he's forced to look at every option available to him.
It's not easy at all. I have to ask my relatives to contribute. We also had to sell some items so I could get enough money for treatment. This pushed us back financially.
However, all may not be lost. The initial bill that proposed universal health insurance was read in Parliament for the first time last November. A year on, a second reading has addressed funding questions posed by the opposition. Health Minister Umi Mwalimu said the government will establish an equity fund to finance the cost of treating chronic diseases like cancer, kidney, and heart problems for poor Tanzanians.
We believe this health insurance scheme will help citizens participate effectively in development activities, helping them avoid poverty, more diseases, and even disabilities and death.
Resources for the equity fund will come from revenue collected from various government charges like levies on carbonated drinks, liquor, gaming, and electronic transaction levies. The funding plan is expected to benefit 15.8 million Tanzanians that are economically unable to pay for medical services. Only 15% of Tanzanians have health insurance cover. The rest of the population faces high healthcare costs, and studies show that the majority of people in the informal sector are unable to pay premium as low as $4, mostly due to poverty. The government says there will be penalties for anyone who does not join insurance schemes 3 years after the enactment of the law. There's mixed reaction on the street to that proposal.
They should make sure it's sustainable. They had tried with the elderly insurance scheme. That failed.
I feel if we truly decide collectively, we can achieve this success with this project.
Tanzania joins other East African governments in their quest to provide universal healthcare coverage to their populations. But experts say it needs to create an universal health insurance law that provides the needed medical services through a funding system that is self-sustainable. Daniel Kijo, CGTN, Dar es Salaam.